now we go on to learning from beyond the boundary. And Dr. Aparna will take us to four in persons who are in the field, and they will give us feedback on what they expect medical education to do for them. Dr. Aparna?
Yeah. So thank you, everybody, and thank you for that wonderful summarization, Professor Sir Menon sir. It was indeed a summary of what has happened and what we are going to face, and how actually we may not have solutions for everything, but brainstorming always helps. Without further ado, I am grateful for everybody to, because the topic itself is so enlightening, and which everybody of us face. I think people are there, that itself shows this topic needs more attention. I invite, along with my co-host, Dr. Ashok Ratan, my panelist, we have Anand Sharma. I interacted with him through one of my colleagues, and he is into Eureka Analytical India, but based out of India also. I have Mr. Thomas Mathew, our own Caho person, but I interacted with him. He's a very, very highly energetic networking, always on the wheel, who is basically, I think when I ask him, when are you in India? So most of the times we will get his perspective from outside India. We have our dear Balram, who everybody from the healthcare knows him as a quality person with a wide experience, and now I think he's exploring uh, his boundaries outside India with a company which has recently started. Welcome. And then Dr. Setul, who I got an interaction through one of my Abbott engineers, and he was so warm to talk to, and also shared some of the discussions when we had. So welcome, uh, Anand, Thomas, Balram, and Dr. Setul. Without further, things, let us touch base upon what Dr. Ashok Ratan has tried to do very honestly, without a packaging kind of a thing, to touch on these topics. Let me start with Thomas. With your extensive experience, which I have heard, you have been traveling extensively apart from India in Middle East and I mean, maybe South Asia. So what do you think? Because when you look at healthcare today, when young people ask me, Madam, what should we take? If they are taking anything in their career, be it medicine, be it pathology, be it gynec, I think quality accreditation is the basic framework when you are entering the corporate world. So what do you think is going to influence the medical education reform? And also your take on AI, because this AI and digital innovation, how are you looking at this when you're traveling in these areas where you're extensively consulting and shaping these organizations? Thomas.
Thank you, Dr. Aparna and Ashok sir, and wonderful panelists or wonderful faculties we had. It was a very wonderful, I could say that such an enriching session. I was just messaging Dr. Aparna, we could have extended it for, upcoming sessions. Such a wonderful faculties we had today, and, it was very heartfelt experience hearing from them, your experience when it comes to medical education. So I just wanted to touch upon 2 points as Dr. Aparna Jairam told. One is about the quality and patient safety and accreditation, which has to be which has to think about when it comes to medical education, and how the latest technology and that need to come on board. So especially when we really spend helping hospitals across the region, Middle East, Africa, and India, and particularly international accreditations in this particular region, we start seeing everything in the lens of standards. So even when I go to a restaurant, I expect that my coffee comes like a tracer of patients. So that's what is actually it's happening. But the twist of medical education comes here. I feel that the medical education often continues after the medical schools. When our young doctors are thrown into this real world of healthcare and medical care, where accreditation, patient experience, and comes in, suddenly they started learning about patient experience, incident analysis, root cause, hand hygiene audit, key performance indicators, leadership and governance. I believe probably these are currently missing in our graduation education in India when it comes to the particular curriculum. This is something we need to really think of it. So accreditation just don't prepare a hospital for audit. It transforms a conscious staff, a conscious medical staff into a quality and patient safety aware professionals. So I will say that it's a daily education happening, the post once you come out of the schools. Sometimes even I joke, doctors comes out with a stethoscope. The moment they reach the hospital or once they land in the hospital, they have to pick up a clipboard and checklist and go around, start doing all this about patient safety and, of quality and patient experience. So I believe that maybe this is a high time we should move some of this training upstreams into the medical schools instead of surprising them, the young doctors, when they're thrown into the real hospitals situations. So accreditation turns hospitals into universities and the corridors into classrooms. That's what I believe, where patient experience matters a lot in this era of medical care and patient experience.
I think, Thomas, with the passion which you speak, that I have seen, I interacted with you in Dubai recently, and that's where I felt that it's a pleasure to see you talk. And what you're talking is actually the fact. I think Dr. Ashok Ratan sir will also agree with us when we are having various conclaves through Caho or individually, people just talk about acha accreditation. But when we are actually talking to the clinicians, and they are like one of the biggest referral hospital here in Mumbai, when they are going for their NABH and now they are recently now enrolled with JCI, the clinicians are like, oh my God, ये भी करना है? Am I supposed to do this also? So I think when we are looking at medical education recalibrations, these are things which have to be inculcated right from, it's always said, catch them young. And that's when we as a country or globally will really achieve real good, real sense of patient safety. Now, coming to Balram, I happened to meet you recently, and Thomas, he has just, all the panelists, thank you for staying back. He has recently tried to do something in Dubai and looking at consulting, hand holding, particularly of the labs, if I'm not very wrong. But what is your take when you're doing work in India and when you're interacting with technical staff, most important in terms of interpretation of a test? Like, I have a funny episode where I interviewed some highly qualified person about microalbumin, and the answer came to me was it's a small albumin. I'm not joking, and this is what has happened. So, where are we looking at healthcare, and what is your take on that? Like, what do you think? Uh, your experience.
Ma'am, first, thank you, Professor Ratan and Caho, for giving this opportunity. It's been a great session, and I'm very passionate about this subject, ma'am, because I think, and I don't think it's just for the technicians also, even starting with the doctors, because today a treating physician bases everything on that one lab test or an X-ray report that he's getting.
Yes.
Right? How much today does even a doctor understand about the test that he's prescribing, number one, and the result of the test he's getting? Okay? And you run a lab, ma'am, Professor Ratan, you run a lab. I think many times you've had doctors calling you and saying, what is this test for? Right? So I think that's something that should be recalibrated as we go along. And the second part, ma'am, as you said about the technicians, I think technicians get a lot of theoretical knowledge which goes into their teaching, but when they actually come out into the real world, practically they have to start from scratch.
Absolutely.
And that is something that's really of concern, because today with more dependence on the test result of a doctor diagnosing a disease or a patient, it's very important that people understand what they're doing and the quality aspect behind the result that they're getting. So I think a training or an incorporation of those results, of those tests, of that experience is very important. It's a continuous process. it cannot be stopped, because as you know, every day there are new diagnostic tests coming in, new techniques being done. So I think it's very important that both doctors as well as technicians, they combine and really understand the value of a proper test result, either from a lab or from a radiology point of view given, so that the diagnosis is done in a much better way, and I think more important, in a faster way as well.
So
Because
I think Balram, let's keep it here and take it ahead. So understanding what Thomas says and what you say, it's very, very simple and clear message that we need to actually throw them into the waters without a life jacket is not going to help. We really have to make them prepare. And the only way it is done is various bodies like Caho, there are many mentors who can come on on board, and as it is said, training, evaluating, training, evaluation. I will come to Anand after Dr. Setul, but I also want to come back to Thomas and Balram, because I'm pretty managing the time pretty well now. I really want to cover it well. So Dr. Setul, are you there? Okay. So, why Mr. Anand is here? I mean, the question is, when I spoke to him, what I understood, I think everybody knows, but it's basically contact came to me again through the accreditation body of Dubai, and I met their secretary, and they said that there are a lot of, obviously in India also we have food regulatory regimes, medical academia. I mean, a lot of things which happen, and I think after COVID and many other outbreaks, we are more conscious. So I wanted to hear from you, Anand, that what are basically from where you work out of India and in India. So, what are the latest developments pertaining to regulations for international or Indian measures which are taken? And how many medical fraternity people, if you can roughly tell us a bird's eye view, are associated with this work? And what do you think are the challenges into? Since we are talking about medical education, I wanted to hear from you with that perspective.
Okay, so we are what we eat. Namaskar and good evening to all esteemed panelists and the esteemed speakers. Thank you so much for giving me an opportunity to speak in front of all, great people, Dr. Ratan and Dr. Jairam. So the question to me is, how relevant this food regulatory and safety regime with respect to medical academia, and what are the facts about the food safety and what are its impact on the healthcare sector. So if you see, food regulatory and safety regime is not a part of medical academia right now, but I am having a strong feel that it should be a part of medical academia because of three major factors. One factor is, there are state labs, food testing labs in each state. In India, where the it is headed by CMO, Chief Medical Officer, which is which is heading the administratively part of those hospitals. Then second is, there is a latest notification came from FSSAI, that is on 28th March 2025, wherein they have specified the discipline that now the bachelors of medicine, bachelors of Ayurveda, bachelors of homeopathy should be a part of this food safety regime in medical academia. Then third factor is there was an online survey which was done by Carol Deville University of Romania on medical among the medical students, where they have assessed the knowledge to food safety, where there were findings where they have shown that half of the respondents presented at a low level knowledge of food safety knowledge, with a score of between 11 to 60 points, and only 6% of the medical students have scored 81 to 100 points, which was considered as high level knowledge.
Then, there were some facts, on food safety, wherein about 600 million, almost 1 in 10 people in the world fall ill after eating contaminated food, and 4,20,000 die every year. Then children under 5 years of age carry 40% of the foodborne disease burden, with 1,25,000 death every year. And over 110 billion of USD is lost because of these thing each year in productivity and medical expenses resulting from unsafe food in low and medium income countries. Then there are multiple drivers which are impacting the
Oh, Anand, I'm sorry I'm interrupting you. I wanted to know your take on medical graduates who are interacting or working or associated with your company or your experience. We are talking about, thank you for sharing this info, but we really want to know what's your take or your company's take, that how strong are we into this? Because this is an area which is equally important. When we look at preventive medicine in India, that's a very important topic, but very rarely addressed. That's my take, because when I teach in my medical college, I've seen people are hardly there for the PSM lecture. The point is that's a very, very important subject. So we wanted to know from you as to, what's your experience pertaining to the professionals in your
So,
industry?
pertaining to professionals, while I'm interacting with some people in AIMS, where, as a laboratory, we are working on some projects wherein a lot of questions coming in to do heavy metal analysis in blood. And the heavy metal analysis in water, and that could pose a risk of cancer. So this is something which is a new topic came in. I've started my career almost 15 to 16 years back. But we are doing a lot of analysis on the food part of it. But
Okay.
on the medical part of it, this is my first experience where I've started working with some people in AIMS, where we are getting some blood samples to do the analysis of lead, cadmium, arsenic, mercury, because these are the four major contaminants causing cancer.
Contaminants,
So
yes,
over a
yes.
period of time, if they're having a big exposure, so they could pose a risk of cancer. Then we are doing the analysis of water, where we find a lot of lead contaminant, arsenic, mercury, and cadmium. So these are the four major contaminants which we have found in large ppm levels over there. Then we
Anand,
are
hold on
working
that
with.
thought. We will have you back with more before losing more, what do you call topics. I would like to hear again. I'll come back to you from Thomas. In India, now you shared internationally. Which is the state, if I tell you choose one state where you feel that your launch, or when you get into a process of accreditation, or you talk about training, where do you find more ease or acceptability or more easy takeoff?
All right. So I think in the very beginning, some of our faculties also mentioned when it comes to healthcare take, I think it definitely it's largely been in South India. And I myself have started, though being I'm a different state person, I myself have started my activity based out of Hyderabad. So I could
Okay.
say that that particular region has a very high take on these kind of uptakes.
I think that speaks a lot about because I think we also share the same feeling when I joined Caho, that when I started training for the lab verticals, I saw more and more people sitting throughout and having more questions or very overwhelming. But I think now the moment has slowly changed. But thank you for that honest answer.
Let me
Coming,
get something in here. Uh,
yes,
when I joined WHO and I was posted to the Caribbean,
yeah,
there was 10 million euro awarded for accreditation of labs in the Caribbean. 10 million euros, which we spent in meetings after meetings. I think every week we would have a meeting, and at the end of 2 years, where the 10 million euro finished, we had made a number of reports, but not one lab, including Carrick, was accredited. Then I came back and joined SRL. SRL was just starting up in Gurgaon. The day I joined was a Sunday, and boss was going on 1 month sabbatical. So he took me there, and the carpenter was still working from Monday. And Dr. Deepa Dave had got it shifted, the lab shifted from the original place to Gurgaon without a break. So from Monday onwards, we started working. And his parting shot of CEO was that I want this lab to be accredited. Now, within 6 months, we had put in all the files for both CAP, College of American Pathologists, and NABL accreditation. And another 6 months, we were accredited first by CAP and then by NABL. I think the message I'm trying to convey is that if the head of the organization wants the lab to be accredited, it will be accredited. While if the head is wishy-washy, then it's not going to happen. I remember before I was going to the Caribbean, I met Dr. Sood. S.K. Sood was the one who was who was involved, and he was in Gangaram at that time. So I asked him, sir, is your lab accredited? So he said, no, it's not accredited. And then I keep asking NABL that your experts should be from accredited labs. If they do not want, if they cannot get their own lab accredited, then how they can act as auditors for other labs and give advice on what needs to be done?
I think Dr. Ashok Ratan sir, as you rightly said, that if the leader is committed, the team is committed. The second point is valid, but we can discuss it when we actually meet. I think I have got Dr. Setul here. Are you here?
Yes, madam. Yeah, Dr.
Hi.
Setul.
So thank you, Preeti, for this last minute troubleshooting. And this is what we learn. So I want to know, you are from our country and now based outside. So what is
Abu
your
Dhabi.
take? Because we are looking at boundaries and what is happening, what is the perception on today when we look at personalized care and preventive care in India. Now there is a big boom. Har jagah packages, Bata prices, and then big diagnostic setups are coming up, and every day you see one coming at least. So what is your take on that and medical professionals reaction to that, or how are they responding? Like somebody said previously, Menon sir said that if somebody is going to say paisa kamane ke liye aana hai, yeah, so it was a very candid discussion. I hope you heard that. So your take on
Yes.
that.
Good evening. Thank you, Dr. Aparna, and really appreciated Dr. Ashok and all our colleagues, their inputs. As already other colleagues has stated regarding the Qatar, Oman, and the other Gulf countries, few of are from the Russell Kaima. Uh, Madam, here how the things are being looked like. I am here since 2009
Yeah.
in Abu Dhabi itself, is the capital. The different region has different, but now we are talking about the in the recalibrating about education. We are talking about accreditation. We are talking about the pathologist or lab personnel, or we are talking about the healthcare professional. Uh, in specifically in Abu Dhabi region, the government and the federal authority, they are very much mandate, and they are enforcing the healthcare personnel to go for the patient care. So they have imposed accreditation by force since 2015. It has been imposed like for in laboratories and other healthcare. They have imposed ISO 15189. They have imposed the CAP accreditation for the hospital, JCI accreditation. So here there are people are coming for the view of the coming for the earning of the money, but at the same time it will not directly work out without the output to the exactly the patient care, with the help of our, as we all are the doctors, and as we are all the healthcare professional, we are caring for the patient. If like say for example here few patient came, and if there is no insurance, and if patient died, because of the insurance issue or because of the XYZ issue. The healthcare has imposed ban on that full healthcare facility. They have closed and they have shut down. So the prime important here, yes, people are earning, not that they are not earning. People are also exporting with their their sales by the selling the healthcare services. But at the same time, the healthcare authorities are very much means strict on that they are not allowed.
Dr. Setul, just a second. It's very important to have a dialogue, and I'm grateful to feedback from Mr. Dr. Jitendra Pratap Singh that medical education calibration. And then why are we talking about this? We are talking about this because just I will take a minute and interrupt you because it's very important to address this feedback. I am a gold medalist from Grand Medical College. I remember when I passed out, I think Dr. Ashok Ratan sir or Seema madam knows that when I was interviewed and I was asked for a basic thing about thyroid, I was not able to answer because my gold medal was only for histopathology, I guess. And then I was told by my ex-boss, Dr. Sushil Shah, I'm grateful because he made me whatever I have achieved little today. He said, Aparna, I know how to meet the needs which are changing daily, okay, and evolving. So you need to be understanding how to calibrate what is needed, and that need is going to change in every decade or every 5 years or every 1 year. So I think what we did was to have a big panel discussion with leaders who spoke about their takes, and we had a summing up with Professor Menon. And now what we are looking at, we are looking at experts who are also hand holding various healthcare professionals across maybe UAE. I think Thomas is also into Africa, and many more people into from like Anand is from the food industry. Setul is migrated from India, and we are trying to hear how are they meeting the evolving healthcare needs. So I'm sure I have answered it, and I'm sorry, Setul, I had to cut you. Um, Anything else from Balram or Thomas you want to add? Because I know the session has gone a little bit more, but it was every minute was worth it. Trust me. Anything else you want to add,
No,
Thomas, Matthew?
Only
I just want to add one thing, ma'am, that as you said, it's going to be a continuous evolving process from now on to get the people to be trained continuously, because it's, as you said, it's an evolving field, whether it's every 1 year, 5 years, or 10 years. So it's important that we understand the training needs and requirements of people and act on that accordingly.
Thank you. Thomas?
I think I just missed the one part of the question. How do technology or artificial intelligence, it's evolving into medical education?
Yeah.
I think just think about in this way. Tomorrow's young doctors just won't be learning only, how to interpret an X-ray or how to interpret a heart murmur. They also will need to interpret algorithm outputs. They
Yes.
need to validate, machine generated assessment notes, and they need to understand how AI flags a deteriorating patients using patterns from, laboratory results or sentiment analysis. So I
Absolutely.
believe it's a high time that we should also move the learning on technology also as part of the medical education, and that's a high time.
Absolutely. Anything else? Otherwise, I will hand over it to my sir, Dr. Ashok Ratan, to conclude. And I hope that we have many more such experts coming and enlightening us.